Fellas, listen, all I can tell you is that this one's for you and also the rest of the family that cares about you. Dr. Erik Castle is here, urologist with the Mayo Clinic. We welcome you to the Daily Mix, and every fella in the world welcomes you with a conversation that we can have about the prostate. So let me start with, why do I have one?
Why do you have a prostate? It's a vital organ for reproduction, sexual function, and urination.
And an awful lot of guys are really concerned about surgery because they're afraid that that part of their lives will automatically then be over.
Absolutely, and it's not the case. But that is one of the only cancers that we treat where quality of life is equally considered as cancer control, whether it's sexual function or how they urinate.
So is there something that I can do, though, in my pre-cancer life to prevent it from happening?
You know, we've looked at all kinds of things, whether it's medications, supplements, nutrients, but bottom line is really going to be detection at the right age and for the right patient.
What is the right age?
We want to start now earlier. We actually don't even use the word screening anymore. It's called early detection of prostate cancer. So there was an era when we would test a PSA, which is the blood test, that would pick up the cancer in every man all the time.
Now, you say though, we used to do PSAs.
Yeah, we stopped. Not doing PSAs, but doing them routinely in everybody.
Okay.
Now it's the job of the physician to educate the patient about the benefits and the disadvantages maybe of being diagnosed with prostate cancer.
That's what I wanted to check, because you pick up articles that say that we've been doing it wrong all this time. Have we?
Well, yeah, to a certain extent. We're learning all the time, right? You know, sometimes we know all of the information, sometimes we don't. I think we're doing a better job now.
Well, I've also read those same articles, and somewhere near the end, in a black border, it says, however, if you get prostate cancer, you might as well go ahead and take care of your family documentation because it's over. It's always fatal. And that's not true either.
That is not true. It still is the second most common cause of cancer death in men in the U.S. But the difference is there's a disproportionate number of men compared to other cancers that won't die from it. And we have great treatments. At Mayo Clinic, we now have special screening, special types of PET scans that are only offered at Mayo Clinic. We have MRIs that are used now to detect the cancer and to diagnose it, advanced technologies for treating it, whether it's robotic surgery or proton beams. So men can live a long life with or without prostate cancer.
Well, you said let's start earlier now, and that's the philosophy of medical science. How early?
It can be as early as 40. Depending on patients that are at risk. So men who have family history, we know they are at significant risk. Certain races, African Americans, have worse prostate cancer when diagnosed with it. And there's other family associations, including families that have breast cancer and prostate cancer that share some genes that can cause. Yeah. We're now doing very special gene sequencing in men who have clusters of prostate cancer and breast cancer in their families.
Talk to me about warning signs.
Yeah, there's very few warning signs. The way we diagnose prostate cancer is by looking for it. If you have symptoms of prostate cancer, the cancer is so advanced that those patients are in trouble. So most of the time it's having a discussion with the physician, knowing when to get that blood test and that exam.
So if you happen to be in your 40s, mid-40s or so, would be a bad idea.
Yeah, get that initial one.
Make sure you have a urologist.
Absolutely.
This one happens to be somebody who you can run into in the hallways and the examination rooms at Mayo Clinic. He's Dr. Erik Castle.